All right, so why don't we get started? So thank you for coming today. Our wonderful speaker is Pavithra Nandanan Menon, and the title of her talk is The Downfall of the Dai, an intersectional study of the politics behind the fall of India's oldest female health practitioners. And I'm just going to give a brief introduction of Pavithra. Pavithra Nandanan Menon is a fourth-year Ph.D. scholar and doctoral candidate at the Comparative Asian Studies Programme in the Department of Southeast Asian Studies at the National University of Singapore. Prior to joining NUS, she was working as a consultant in Mumbai with KPMG India, providing technical assistance to the Department of Social Justice and Special Assistance, Government of Maharashtra. She also holds an MA in English Literature from St. Teresa's College-Mahatma Gandhi University, Kerala, and an MSc in Gender Development and Globalization from London School of Economics and Political Science. Her broad areas of research include gender, transnationalism, dysphoria studies, race, ethnicity, religion, caste, feminism, colorism, and intersectionality. Her upcoming work can be found in the Indian Journal of Women and Social Change. Pavithra, I'll let you take over from here. Looking forward to your presentation.
Thank you. So as you can see, my presentation today is about the midwives in India who are called the Dais, or Dai Ma. Ma is mother in India, and Dai refers to midwives in India. So this study would look at how the profession of Dais have been dwindling over the years and how it can be looked at from an intersectional perspective. The Dais, I will just brief a bit about what I'm going to do today and what this is about. So as one of the ancient professionals, one of the most ancient professionals of social significance, Dais, as the traditional Indian midwives are known, have served the Indian society since time immemorial. However, with the strengthening of caste system and imperial cleansing of indigenous birthing practices, the Dais were deemed as unfit for the job by imperial policy and unclean by the upper caste. They were replaced by the westernized medical doctors and upper caste, Ayurvedic Veds. It is also to be noticed that the makers of the imperial policies as well as the caste rules were mostly men. While imperial policy used cleanliness as a weapon to medicalize childbirth, this was also supported by the caste system ingrained in the Indian society, which used purity as a weapon to ostracize the Dalit or the lower caste Dais. Though the Dais were associated with polluting activities such as cutting the umbilical cord and cleaning the pregnant woman's body, as in the Brahminical text or religion at that time, a pregnant woman's body was considered to be impure and disgraceful, and hence the Dais were considered to be playing a very impure role as well. However, it is also to be noted that they played very important roles of equal parts as grandmothers and gynecologists. Today, even the educated middle class and elite class women choose against traditional birthing practices and choose the kind of childbirth they want, whether it is natural or cesarean, but avoid the help of the Dais. This is associated with the idea of autonomy of body and choice, rural-urban divide, and class. It is also a way by which the educated upper class and middle class are defining themselves and shaping their identity by gaining control over the space of women's reproductive health. Dais are now facing extinction owing to the increasing obsession with modern medicalization of childbirth, as well as a rigid caste discrimination that seeps through the modern educated society even today. This paper would look from an intersectional lens the dwindling profession of the Dais in the process of the perceived notion of modernizing birthing practices and initiatives, in the process of perceived notion of modernizing the birthing practices and initiatives became based on rationality along with the vilification of Dais. This paper would also look at how in a country where around 67,385 babies are born in a day, according to the UNICEF data, which makes for the 1/6 of the world's childbirths. A holistic approach to childbirth, wherein traditional and modern childbirth practices would work in unison with each other, would benefit the mothers as well as the traditional midwifery. This would help in reducing the unemployment of the DIEs as well as improve the overall health of young mothers and their babies. While in many parts of the Western world, midwifery is recognized and respected and a licensed profession, in India, where DIEs, who were once the go-to person for childbirth and pregnancy-related issues, have completely been wiped off the business. The paper would examine the reasons for this regressive progress from an intersectional lens. The paper also proposes the need for creating a special midwifery academy. Midwives can be trained professionally to work in partnership with the Ministry of Health to reduce the maternal mortality. This would require marrying technology and tradition to provide the women with intellectual skills, knowledge, compassion, and socio-psychological skills. The paper would thus propose the need to create public awareness as well as rethink the policies for protection and revival of midwives with the dignity and autonomy that they deserve. Now, globally, most mothers lose about 500,000 mothers lose their life every year owing to childbirth-related complications. And 90% of these deaths, according to the World Health Organization, happens in the developing world. And even in spite of an array of programs that have been developed across time, India has a huge maternal mortality rate because of the inconsistent policies and lack of evidence-based interventions, which could protect which could potentially protect the mothers. It is also coupled with socio-demographic factors such as caste and rural-urban divide, gender, class, and so on, which I'll come to later on. In 2007, WHO stated that India's maternal deaths accounted around 25% of the total global maternal deaths. And some of the causes were hemorrhage, sepsis, pregnancy-induced hypertension, abortion, and so on. And most of these were preventable had there been skilled birth attendants. Prevention and timely management, prevention of death and injuries, as well as timely management of life-threatening complication related to childbirth is one of the paramount priorities that a country should have. Who are the skilled birth attendants? Now, many of us would think these are just doctors. Not really. Under the World Health Organization and International Confederation of Midwives and the International Federation of Gynecology and Obstetrics, they define skilled birth attendant as an accredited health professional, be it midwife, a doctor, or a nurse who's been trained and educated to deal with skills which is needed to manage uncomplicated pregnancies, childbirth, and immediate postnatal period in the identification, management, and referral of complications in women and newborns. So a lot of evidence-based studies have shown how these maternal deaths can be reduced by the presence as well as timely intervention of a skilled birth attendant at the time of childbirth, and this could be a midwife. And one of the major features of women's health movement in the West in the 1960s and 70s was to regain the pregnant woman's body from the authoritative control of the male-dominated medical establishment, as well as to revive their midwives to their traditional role as a mediator between nature and culture. Now, who are the DIEs? DIEs are one of the most ancient professions in India. They are the traditional Indian midwives or birth attendants. They were respected and feared as carriers of natal wisdom, which has been passed on from generations through communities and families and villages. And each village has their own customs and traditions related to childbirth, including their diet, including small customary functions. For example, in southern part, there are some who advise that we shouldn't have too much yoga during pregnancy, and so they kind of control the nutrition and activities that are allowed or not allowed during pregnancy. Like pregnant women are not allowed to walk out after dusk. Similarly, like getting the first ray of sunrise at dawn. So many small little details are usually like imparted by the dais for the benefit of the baby as well as the mother. So they are like a grandmother, a friend, a doctor, all in one. The expertise of the traditional skills and the wealth of knowledge was usually derived from the ancient science of Ayurveda. Dais or Dai Ma means mother, as I mentioned earlier, treats childbirth as a natural process rather than an illness or a scientifically mediated process which needs to be medicalized. They deliver around 67% of the babies born in the country. They have the skills to nurture the expectant mother and the newborn baby, or they're supposed to have the skills. Other than attending to childbirth, they give emotional support to the new mothers, hand-holding them through their new journey, right from the day that they know that they're pregnant, which is also detected sometimes. They help them through the journey in different fluctuations that they go through physically, emotionally, and kind of prepare them for what is to come in terms of the child and how to take care of it. So, however, recently we have seen a downfall or dwindling in the dais profession, and they have sort of become extinct, or they are looked down upon in the Indian society. Many of these practices or beliefs or customs that were followed by the dais are now being endorsed by the modern medicine, especially Western medicine, with the prestige of midwifery growing as well as being licensed as an institutionalized profession, as opposed to India, where dais and the practices followed by dais are becoming less popular. Why is there a regressive progress in the traditional birth attendants in India? I'm going to use an intersectional lens to analyze it. Now, intersectionality, as many of you would have heard, is a concept that was developed by Crenshaw, and it was used to sort of describe the multiple discrimination faced by Black women in America based on gender, race, class, color. What she tried to say is that discrimination or the struggles of a woman, especially a colored woman, cannot be described on a single axis because there are multiple identity strands which come together and come to play in the discrimination that they face. Similarly, in the case of dais, there are a bunch of factors that I've listed over here, like caste related to purity, race related to religion, gender, especially in terms of medical misogyny, rural-urban divide, class, the middle class, the urban elite class, low socioeconomic background, basically lack of money, illiteracy or less access to education and skills training. And all of these are interconnected. One leads to the other and hence cannot be studied in isolation from each other. Now, I'm going to start from race. So childbirth in pre-colonial India was a female-centered practice which was completely dependent upon the wisdom of the female figure called the midwife. But what happened is this norm was encroached by the modern medical science, which is wheeled or which was sort of fueled by the racial tendencies of the colonial rule and the rise of the English-educated middle class, the casteist Brahminical ideologies, along with the gendered encroachment of men into the autonomous terrain defined by midwives, time-honored authority of childbirth, because childbirth was dealt only by women at one point. A combination of all these factors led to the marginalization of midwives. Now, the colonizers used the term cleansing. So I'm going to use the term the colonial cleansing of childbirth. The topic of medicalization of childbirth in post-colonial India usually is based on the reformation in terms of sanitizing or cleaning the indigenous birthing practices because they were considered to be unclean or dirty. The late 19th century initiatives were mainly focused on, or it was rather a response to the Western educated colonized middle class to the colonial critique of Indian socio-cultural codes. So both the middle class and high class elites started defining themselves as well as constructing their identities in relation to, which is mostly by distancing themselves from the dais. And it also became a mode of controlling and deciding the space that is accessible to the lower class as well as women in terms of medical practitioners. So it became a part of a middle class way of life to gain control over the women's reproductive health and the space that was sort of controlled by men mostly. So the elite middle class replicated the colonial view of attacking the native low class dais because the dais were then deemed to be unclean or impure. The notions of sanitized self, reformed domesticity, values and ideals upheld by the colonial state, all of it determined sort of how they viewed the dais, which was not in a very good way. Now, the colonials and reformist discourse of the 19th century was mainly focused on discrimination or vilification of dais, and they focused on a more modern, rational approach towards childbirth. So there was very little emotion involved in it, or the nurture that was provided by the dais. So who are the dais? As I mentioned, they were from the social economical background was one of the reasons why they were left behind from the mainstream medical profession. Most of the dais are poor women from lower economic background, hailing from the rural villages in India. There are many villages, and some of the case studies, many case studies have been done based focusing on villages. I'm not mentioning the names because of the time constraints. And many of the people, these people from the rural villages, they have no access to education or they're mostly illiterate. And both pregnant mothers and dais have very limited access to clean clothes, blades, hot water, sometimes even torch, and other necessary tools which are necessary for delivering a baby. Because there were instances where dais were complaining about how they couldn't even go to the place of the pregnant woman. And once they go there, there is no electricity for them to see what is happening. So they didn't even have a torch. So they had to literally work in the dark in many aspects. In the dark, in the sense they are not medically equipped, neither are they equipped in terms of the infrastructure, neither are they equipped in terms of logistics. They don't have vehicle or anything. So these experiences put them in a rather helpless position, which makes it difficult for them to ensure the safety of the babies as well as the wellness of the mother. Now, in 2015, there was a Times of India newspaper in India. They reported that in Uttar Pradesh, the villages in Uttar Pradesh, bangles, broken glasses were being used to cut the umbilical cord of the women delivering the babies. I've just put a cutter of the paper. So many of the health practitioners, the doctors were complaining that this is because of the lack of awareness or accountability of hospital staff. But I would also say this is because of the lack of access. Most of these places do not have access to proper hospitals because it's far away from the cities. And then they do not have awareness or education, and they don't have the money to actually go to the doctors. And most of the educated doctors do not want to relocate to the rural areas either. So there is a total lack of accessibility to the state-of-the-art technology as well as medical practitioners. So some of the doctors complain that the dais use instruments which are not sterilized. First of all, they don't have means to sterilize it. Sometimes there is no water. And they also use they use blades to puncture the amniotic sac. And some of the doctors also mentioned how the methods that they use are so unsafe that it can cause infections after the delivery because it's not cleaned properly. And sometimes untrained women practice midwifery, and this causes a complete chaos leading to the death of the woman, especially there are complications. So they use like ordinary scissors, which is not medical scissors, and threads from a quilt to stitch the private parts. So these are practices these are also because they don't have any other means. And because of all these reasons, dyes have over the years have been branded as unapproachable in many ways, or dangerous for especially dangerous by the educated women, especially who do not want to get the service of the dyes in any way. So because of which over time they have no dignity, they have no respect, and they are also poverty ridden because they don't have jobs. So health okay, I'm just gonna. So other than this, dyes were also deemed as dirty, ignorant, and barbaric by the colonial rulers. Now, this provided an impetus for education of women in the medical field as doctors. So many of the women, especially, this is another thing another thing that we have to pay attention to over here is that the women who had access to education, especially medical education, were from upper class elite, as well as they were belonging to the upper caste and not the lower caste or Dalits. So they were privileged women basically, and they had the impetus. This provided the impetus for them to be educated, especially as doctors. So even today, like to be a doctor is considered to be one of the best professions for women in India, and engineering is considered to be a good profession for men. However, the absence of masculization of obstetrics in India due to cultural practices of seclusion and the notion of modesty and female virtue was stated as a reason for the lack of male participation in the profession of midwifery in India. And medicalization of childbirth in India was also promoted by female doctors. But one gap that happened over here is that while they were adjusting, as well as while they were fighting their best to like make a space for themselves in the male-dominated medical establishment, they completely forgot about the dyes, who were and still continue to play a significant role in the cultural dynamics of India, especially the rural female population. Another important factor that led to the downfall of the dyes was the caste. Now, most of the dyes, as I mentioned earlier, come from the lower caste. Dirt or filth of low caste dye, along with the customs related to birthing, its hygienic, scientific, moral superiority, related to, led to discrimination of dyes, because already with the medicalization and with the progress of medicine, as well as the caste system, there were rumors of how the dyes practiced childbirth back in the rural areas. So the colonial state of strategizing the notion of cleanliness as a weapon for introducing Western medicine was also used by the Western educated middle class Indians against the dyes, but they also included the element of caste in it. So now caste and race and the colonial dynamics of cleanliness and purity and impurity came together. So high caste Indians and sanitized cleanliness became an ideology for asserting middle class identity and working as it did in tandem with the ideas of caste purity and pollution. So today, dyes are facing extinction because of the obsession with modern medicalization, as well as the rigid caste discrimination which seeps through the education even today. One more thing that is to be noticed is that Ayurveda, though the traditions or customs that were practiced by Dais, their wisdom was derived from Ayurveda. Ayurveda in general was only accessible to the Brahmins. It was not accessible to the Dalits. So again, there was a big gap in how much of wisdom that they have gained from the scriptures, because most of them were illiterate, so they couldn't read. So all the wisdom was passed down and diluted from generations, and many of it were wrong. Or rather, it was not updated to the needs of the time. Now, while imperial policy used cleanliness as weapon to medicalize childbirth, it was supported by caste system which used purity to ostracize the Dalit Thais. Now, it is to be noted that both the imperial policy makers, the caste ruler, as well as the makers of the caste policies were both men. They were not women. So even today, middle class and elite class women, they choose against the traditional birthing practices. They choose any kind of birthing practices, but within the modern medical regime, like they can choose natural or cesarean, and they usually are there in the hospital for just a couple of days, and then they are back and about with their life. But this is not how it used to be in olden times, because the postnatal care was also like a very important part, where the Dais would give in, come home and give them massages, give them soup, medicinal soups. All of this just went away, and this was associated with the idea of autonomy of body and choice, rural-urban divide, class, and so all these intersections led to the gradual dying of the Dais in India. And now it's almost a dying profession. And more than a dying profession, its reputation is under stake right now. Now, in 1797, the first lying-in hospital for maternity was built in Madras city. Why I'm bringing in this history is because the profession of the Dais was not alien to India. The British government established the Central Board of Nursing and Midwifery in 1902 to ensure safe births, and they provided quality services and training to the midwives. In 1926, the Madras Legislative Assembly was passed. They passed the Midwifery and Nursing Act to professionalize it and provide them with professional training, training in midwifery, as well as to nurses, as well as to the Dais, for the traditional birth attendants. This led to the formation of Madras Nursing and Midwifery Council, and it was the first ever nursing and midwifery council to be founded in Southeast Asia. So these courses that were prescribed for the nurses, as well as the traditional, as well as the Dais, they completely shifted from hands-on practical training in the field towards a very theoretical training, which focused on preventive care services. So the nurture part of it was missing already. And because they were focused on being a professional in terms of just quickening the whole process of delivery and letting them go from the hospital, rather than making it a slow process which requires a lot of nurture and care. In 1972, the midwifery component was further shortened, and from 9 months to 6 months. And all these factors, so you can see that the importance of midwifery and the component of midwifery just started decreasing over time. And all these factors, along with the medical profession, the rise of medical profession and the modern medicine, led to the dilution of the role of midwives from India. And the separate midwifery training just shut down. There were only nurses who were trained to, not just for midwifery, but a bunch of other things. So a professional association for midwives was no longer there. And there was a constant resistance for recognizing midwifery as a specially trained profession, or they were not given a due status. So they were not recognized. From being the oldest professionals, they became a profession that was not recognized over time. So with that, why this happened? A lot of socio-cultural factors. Now, it is regarded as a low-value profession, as a servant to the doctors and not as an independent clinical professional. In India, most of the midwives and nurses are females, whereas doctors are males. So it became a very gender profession as well. Medical students from urban, as I mentioned earlier, medical students come from urban areas and they're usually higher caste and upper class or middle class, while midwives or dais are from the Dalit caste or lower caste, and they're from the rural areas. Upper middle class women also do not enter dais as a profession because it is considered to be menial. People look down upon nurses and midwives even today in India as compared to doctors. So even this is carried forward even in terms of marrying. Like if you're a nurse, you marry a nurse, so it becomes a class. The class divide is very evident in India. So the caste and class come into play. So usually the traditional dais consist of widowed women, unmarried women, or divorcees who have no other choice to take care of family. So they take up this profession. They're not even trained, but they're just passed on from their ancestors and they take up this profession. So a combination of intersectional factors and low professional status also led to the neglecting of dais in the policy making. Most of the policies are made by the politicians, the bureaucrats, and the doctors, and there is no representation of the dais over here. Now, the dais, the effects of medicalization. They have been looking after women in India from the time of conceiving till the time of childbirth, and sometimes even after that. Like in the village that I come from, the dais, they give massages to the women after childbirth. They also give special massages to the babies for like sharpening their features and shaping their head to make sure the spine grows properly. All these services are now missing with the medicalization of childbirth, which has become more of a very ready-made process. You go in and you come back with a baby. There is no emotion involved or the nurture that the dais used to provide that is not involved. Until recently, they did. There is also another reason for this because of the lack of awareness and knowledge that dais possess in terms of the modern medicine, knowledge of life-saving drugs, and the technologies like forceps, even the use of gloves or sanitized scissors and hot water, as I mentioned, they did not have access to all this. With the modern medical advancement, doctors have gained power with medical and surgical complications of birth. National Health Survey of 2006 mentioned that the percentage of births conducted by doctors is 35.2 now, which is much higher than nurses, which is put together with all the nurses put together. Technology, prestige, social value associated with being an obstetrician rather than being a midwife is one of the reasons for this. And another major effect is that the urban private sector, as well as this modern medicine and expensive medical treatments and doctors are inaccessible to the poor. And the dais have also lost their independent identity as medical professionals. So WHO and other international agencies have now rediscovered the importance of midwifery and skilled birthing attendants. Government of India, however, under the Reproductive Child Healthcare Program and National Rural Health Mission, developed policy for promoting institutional childbirth. They provide incentives to the mothers who go to the hospital instead of using the services of the dais. This is because of the notion that the dais don't have the knowledge or the technical know-how on how to save the women in case of emergencies or complications of childbirth. So the government policies have neglected quality professional services for birth through the development of midwifery. Neither have they sort of created a cadre or any sort of facilities to provide education to midwives. While most, as I mentioned earlier, the policy decisions are made by the bureaucrats or doctors and politicians with no representation of midwives, one of the reasons being they're illiterate and they have no access to the power makers or even education. So there's nobody to speak for them. However, one thing that is to be noted is that 70% of the Indian population is rural. And most of these population who reside in villages don't have access to the private sector and the modern medicine. Also, given that the population of India, as I mentioned earlier, the 68,000, more than 68,000 babies who are born in a day, there is a shortage of doctors in the country. And the doctors cannot handle all the childbirth. And moreover, most of the educated, upper middle class, elite doctors are unwilling to move to the rural areas. So with the development of high quality professionally trained midwives now becomes a necessity because they would play a role as a backbone of birthing services in the country. Midwives will have to work in teams with medical officers as well as doctors and obstetricians to provide emergency obstetric care and neonatal services. So there is a necessity to develop a cadre of skilled midwives reducing maternal and neonatal mortality. A separate regulatory body for midwives should be formed. Earlier, like in 2009, a Society of Midwives in India was formed to develop a separate identity for midwives. And by 2009, by around 50 chapters and 4,000 members were there all over India. So women still come to institutions for birth and they are discharged, as I mentioned earlier, in 1 to 2 days. So there is no postpartum care that is provided, and usually this is at home. And while at home, these women need special care in terms of healing and getting back to health, as well as taking care of the baby. And this is where midwives can actually help. Majority of the maternal deaths in India occur during birth and postpartum period because of lack of skilled care or preventable and treatable problems such as hemorrhage and infection. Skilled midwives, I'm sorry for the spelling mistake, skilled midwives can provide this care as well as assist in normal birth. Because these midwives are considered to be good diagnosticians. So in case if there is an emergency or complicated cases in the village, they can either take care of it if they have the skills, or they can even refer them to the next hospital nearby. So more complicated cases can be referred to the district level hospital. This way, even the hospitals and the doctors won't be pressured. There will be a team of professional midwives and the doctors or obstetricians who work together to provide the comprehensive services. Rural professional midwives can be only source of definitive emergency care because they live in the villages among the villagers, and it could be life-saving. In many rural remote parts of India, it becomes very difficult because the mothers do not have access to transportation, or their relatives are not willing to take them to urban hospitals, or they have lack of money to just access the modern healthcare system. So in that case, if the dais themselves are skilled and educated, it would be a great help for both dais in terms of creating job opportunities for them, as well as to reduce the maternal mortality rate in the country. So training the dais to work as a team with doctors is something what policy analysts should do. So there are many training systems that have slowly come up. Like one of them is the Jan Swasth Sahyog or People's Health Group. So implementation of DAI training, which resulted in improvement in maternal and neonatal health. So this is one of the, this is a statement provided by one of the midwives. So Rajeshwari, the Sarpanch is the head of the village, delivered last week. And this is a village from Ataria village, and this was given by the TBA, that is traditional birth attendants on dais, Miki Bai and Jayamati. They reported that a boy baby was born and she started bleeding and it would not stop. She was feeling faint and cold. We remember what we had learned here as in the training that was provided, that compressing the uterus with one hand fisted in the vagina and another on the abdomen. We held it like that for 15 minutes and the bleeding stopped. She recovered after that and she's fine now. This was something that we would not have been able to manage a year ago. So with training now, they are able to manage some emergency situations, and this is also reducing the pressure among doctors as well because of the population in India. So yeah, with that, I'm coming to the end of my presentation. Yeah. Thank you.
Thank you, Pavithra. That was a very fascinating presentation. If anyone has any questions, feel free to type them into the Q&A box. I'm happy to start off with a question. So I had a question about, since you mentioned historically speaking, Dais were fairly, illiterate, they didn't have access to a lot of resources or education. So in these training programs that have been implemented, is that still the case? Are they able to provide education through oral formats without necessitating literacy, et cetera?
Yeah, so literacy programs are being conducted, but now there are also requirements like at least a diploma is needed, like a 10th standard and a diploma is needed for them to enter the training for basic midwifery training. So without the basic qualification, they will not be able to enter the educational provisions. So for most DIs that I've read, 10th standard, 10th grade is which is basically getting through high school, and then they can go for midwifery training. So yeah, illiterates, which is also a reason why there is a need to sort of eradicate illiteracy in India. So education and equality in education is something which is also being focused on in terms of helping out the DIs, also because they are coming from Dalit caste. Yeah. So there are like a lot of reservations in India, like scheduled caste, scheduled tribe, and other backward classes there are schools which are being set up in the rural areas where they provide education to them. So I was working with one of these schools. One of the main problems was that they were not able to read the alphabets. Like, for example, a 10-year-old child was not able to read ABCD. And the teachers who were teaching them were just 10th standard or even 9th standard fail. So now the government is providing provisions for those who can like go and train them in terms of, so they are paying them more for providing training and education to the rural villagers, and also vocational training centers are being set up where skilled women or skilled youth are being brought to the city where they are given trainings. For example, Tata Trust, run by Ratan Lal Tata, the trust also provides vocational training to many of these not medical practitioners, but midwives, as well as women and men who want to be trained as home nurses in terms of first aid and other basic help that they can provide at home. So this is one of the services that they are providing. And this is something that is specially available for the scheduled caste and scheduled tribes. So this is also a kind of a method of sort of elevating them in terms of the sort of upliftment of a lower caste. And through the upliftment, by providing them education, they can also sort of, it also provide them an upward socio-economic mobility. So yeah, I don't know if I answered your question.
No, you absolutely did. That's very good to hear that basically the education is coming alongside these programs, which is critically important because, based on your description, historically, of course, there were not as many options as there are now, nor was there as much knowledge or easy access to it as there is now.
Yeah.
But it's helpful. So it's kind of moving away, though, from the idea of it's truly uneducated people who are taking on these roles to being more educated individuals.
And one other way that midwifery is being promoted today is by them showing how midwifery is being appreciated in the West. And I would like to call this a colonial hangover, that people back home really like to emulate the West. So now seeing that this is being so appreciated in the West, people are trying to bring back the whole midwifery. But again, even then, what happens is that the whole small issues of caste, they would ask, what caste are you? All these comes in. So I think it will take a longer while for them to like completely get rid of all these sort of prejudices and then come forward. Because even today, the profession of midwifery is not as celebrated as it should be. Yeah.
Yes, no, I completely understand. These caste systems, they hold on for a long time in terms of attitudes. So it does take a while for people to become more open-minded. But yeah, like you mentioned, I think a lot of Western countries, the midwifery phenomenon has made somewhat of a comeback. And it's largely because of that shift away from a desire for extreme sanitation and medicalization and something that should be kind of a more joyous occasion, like having a baby.
Yeah. And also, like in India, long time back, when there were midwives, they would make the women walk and do a lot of physical activities, which also helped in a normal childbirth. So one thing that's happening now is with the extreme medicalization, that women are told not to move their bodies. They are asked to sit like, not move too much during pregnancy. This is also making the whole delivery a more difficult process, because working out during pregnancy is now being encouraged, as opposed to how, like in the last 20 years or before, like in the 80s, 90s, especially with the medicalization of pregnancy was at its peak in India. I don't think women were working out when they were pregnant, though my grandmom used to say how with the help of midwife and their advice, they'd go on and about doing the physical activities. But that is now changing like how women are now being encouraged to like work out, and there's special exercises for pregnant women. So I think these are like, I mean, whatever was practiced earlier on is just making its way back, but it's going to take a while because there are a bunch of other intersections in terms of caste and class and all these hurdles to pass in India. Yeah.
Do you have any thoughts on, some things or programs that the government could possibly institute that might help with that?
Yeah, so the National Rural Health, as well as Women and Child Healthcare Department, and UNICEF and WHO, as well as the local government bodies. Like one of the bodies that I was working with was the Social Justice Department. We focused just on the scheduled caste and scheduled tribes. So there were like hospitals and set up just for them at that point. But I wouldn't say that these are like completely equipped with everything that is needed for an emergency, but still I think it is a small step towards development. And also now there are a lot of conferences being conducted in India where there are a lot of awareness programs as well, where people from the West are coming and talking to people in India about how good the profession of midwifery is and its importance for sort of making pregnancy a more holistic experience as a whole. So there are because a lot of focus is being given to the mental health. The National Institute of Mental Health in India as well as being involved in it, because maternal health is also greatly linked with the mental health of women as well, like postpartum depression and how to cope with the whole becoming a mother and dealing with the baby and the pressures of the society changing of the body. Earlier, the midwives used to help women a lot through this, because when I said that they used to give a lot of nurturing, especially massages, it actually used to help them get rid of the water retention and sort of heal their body and get back into shape in a rather healthy way. So now with all these institutions, slowly they're trying to bring back how midwives can also be beneficial, but as long as they're skilled and working as a team with the professional doctors. So this is also a reason why there is a need to create a sort of cadre for them, as well as to sort of recognize midwifery as a licensed profession so that people are also not scared of them. Right now, when people say midwife, they think that these are people with no training, no education. But once there is the sort of professional certification to it, people would start sort of being more receptive towards midwives, and which is people are, I mean, government bodies and hospitals are working towards it with the help of a lot of research organizations as well from the West. Yeah.
Thank you. Are there any other questions? If so, you can put them in the Q&A. If not, we would just like to really thank Pavithra Nandanan Menon for her very interesting and engaging presentation. Thank you very much. And I hope all of you enjoy some of the future sessions today.